The first speaker I'm going to introduce you to is a medical doctor, a DMD, a PhD. She taught in Boston University for 10 years. She was a surgeon for 29 years, performing some 15,000 operations. Our guest has the largest practice in Riga, Latvia, with 25 doctors and a staff of 60. She's the CEO and leading researcher of AB Bioinnovations, and she was invited to be the president of Latvia, which she declined because she had bigger fish to fry. So it is my great pleasure to introduce to you Dr. Alena Butkevica. Welcome.
Hello, I don't see anybody, so it's very difficult. If we can switch, how do we see people? All right, so let me do a screen share. Thank you very much, Alex, for inviting me. I agree 100% with every word you said, because truly right now, the medical aspect is a good, oh, just 1 second. Give me a second. There's some, where's my PowerPoint? Yeah. So let me say that I agree. Do I do screen share? Can you see my screen?
Yes. You just
all right, we are going to the
expand it to the whole screen.
Yeah, I'll expand it. Just give me a second and off we go. So we are going to talk today about something what Alex just mentioned. We are going to talk about and only talk about one topic, about human ability, natural ability to heal and to regenerate. And it's really, really forgotten because Western medicine is just, I am a Western medicine doctor. I spent 17 years studying Western medicine. And as Alex suggested, I should start with my life story a little bit to show how people can recover nowadays with different approach and how well it works. So I'm an oromaxillofacial surgeon, and having sort of busy life with a waiting list of 6 months, people flying from all over the world. So I always like nature. So I was an avid horse rider, and that would kind of offset the stress of surgeries and everything. But as it happened, horse fell on me. And I ended up with 19 broken bones, spine broken into places, internal bleeding in every possible place. My right shoulder was completely disembodied. And my hand was technically hanging in the skin and a couple muscles. And doctors said that it has to be taken off. But since I am a doctor and also have a little bit of say, I said, just put it back. So after I survived, what's happened, I was left with a tremendous pain. I just couldn't walk. I mean, the pain was excruciating. On the right-hand side, you can see amount of medication I was prescribed daily, 3 times a day, and I could have some more at 9. So then they put me into the physical therapy to recover. And what's happened, as you see on the left-hand side, it's a classical Western physical therapy. And Western physical therapy is all rubber bands, stretches. And what happens when you stretch or something, you compress. When you compress, circulation stops. And by sheer serendipity, I met a monk from Shaolin Monastery. And from the point where I couldn't hold an egg in my right arm, I'll show you a small video how he put all my body back into the 100% action by doing very simple exercises. And you see, I had broken spine in 2 places on how flexible I am. So he just emphasizes one more time, and that there is another approach, and it's simple and easy, and I'm going to share it with you today. So let's start with the basics so we can move forward. So we were all born complete, and we have 50%, everything is 50-50. Like our inhalation is 50%, and our exhalation should be 50%. And there should be a space in between. So for oxygen and carbon dioxide to exchange, and there should be a space. If you see on my arrow, the oxygen is coming in, and there is an alveolus and an exchange, and then carbon dioxide is exhaled. So it's 50-50. Just now, try to inhale, and then inhale more, and then even more, and it becomes unpleasant. Now exhale, and exhale more, and more, and more. It's not comfortable, because body needs exactly 50-50 amount, inhalation, exhalation. Same goes with the heart and all trillion cells we have in the body. It has to have 50% in, it has to have 50% out. That's how everything functions. That's why we eat, but we are constantly talking about bowel movement and detox. Because if you don't go to the bathroom for 2-3 days, you know how bad and sluggish and toxic you feel, and that's a result. So major causes of the diseases is inflammation. And we'll talk about inflammation, because inflammation also became very popular lately because of different approaches, and marijuana came into place and everything. So inflammation became a number one. But it is true. There are 5 symptoms of inflammation, and majority of course, there is the heat, there is the pain, there is loss of function, redness, but majority is swelling. And we're going to talk today about swelling, because swelling is the major destructive factor which causes the major problems in any part of the body if inflammation exists. So where does the inflammation comes from, and where is stagnation come from? Because inflammation is stagnation. It comes from 2 parts. One part, we don't move enough, we don't do exercises enough, we're stiff. And the other part is stress. And you know very well how many people who are stressful, how sick they get, how they get heart attacks. And stress is one of the major problems which cause inflammation. So let's imagine how inflammation works. I would call inflammation is like a swamp in the body. Nothing comes in, nothing goes out. So just imagine how swamp smells. Yeah, it's yucky. And what can grow in a swamp? Nothing. So natural body, like our skin cells, bone cells, muscle cells, they'll regenerate. In 7 years, our whole body is new. And if we have that swamp, that stagnation, that part is not going to regenerate. It's going to degenerate. And that's how aging happens and disease happens. So let's see, let's look at the ankle inflammation. So now between the bones, we have a swelling. And swelling is a mass of liquid which doesn't go anywhere because body doesn't have enough ability to push it through. So the liquid piles up, and just imagine what would have happened if I pushed onto your hand hard. You would shy away from my hand. So same happens when you have liquid in the joint. It pushes on cartilage, on bones, on soft tissues. What happens? They get squashed. First of all, it's pain. Second of all, it's swelling. And third, which is the worst, it's the body starts to shy away. That constant pressure deteriorates cartilage and bone and soft tissue. That's why we need so many knees and hip replacement, because there is a chronic stagnation called inflammation. So, and it happens, as I said, any place in the body. Our body, as strange as it sounds, is apart from eyes, teeth, and brain, functions the same. So no matter where you have inflammation, is it the heart, or is it the joint, or is it the broken bone, or is it urinary tract infection, is going to be the same. So just have to keep in mind, body is a one whole system. So how do we get from the fearless childhood where we fall down, I don't know, every 15 minutes, and then to the point when we wake up with a pain, we need a massage. So, but let's say, what is a massage? Massage is technically, it's moving blood and circulation and relaxing everything so the circulation can go. But in Chinese medicine, they would call it energy flow as well. So if we wouldn't have a natural ability to heal and regenerate, none of us would have survived age of 5 or 10. It's impossible. How many times we fall down off the trees, especially, you know, we play sports, we just the babies falling over and over. Nothing happens because they are relaxed, they're easy. So the blood quickly circulates and repairs everything. And now let's look what, as Alex said, what common Western medicine is offering us to ease the pain. And one I could look at here is cytokine suppression. Cytokines is one of the elements of inflammation process. It just kills a little bit of inflammation, but it doesn't address the swelling. It doesn't address the cause of inflammation. It doesn't address the blood flow, energy flow, and exchange. It doesn't open the space. Yeah, we looked at turmeric. I mean, it's good. Turmeric is great, but how much turmeric you have to consume? Yeah, so the turmeric would go through the entire bowel system and get right into your knee. It's a lot of turmeric. So now let's talk about AB Bio solution, how to reduce swelling, pain, and get back to our healthy metabolism, and how to regenerate ourselves. And I'll just prove you that it's possible, and it's very easy, it's safe, it's 100% natural, and it has no side effects. We have done research for 11 years now, and we have proven that we can do it in a very, very fast manner. So so it's mostly, now we're going to talk about creams, topical application, easy. So the first thing what we want to do, we want to address the area where we have inflammation. And first of all, and for most of all, we want to get that pressure out of the joint, and we have to flush out toxins. But at the same time, so we want to open the space. Once we have opened the space, then we need to boost the blood flow, because with age, blood flow doesn't go as fast as it used to be when we were 5, 6, 7. We have to boost the blood flow to go into that space and bring oxygen and nutrients for regeneration of the space. That is the bottom line, what has to be done in any occasion. So here is an example of 83-year-old man who said that nothing can help him but plastic surgery. And I said, well, let's see what can body do for you. And we used a complex, which I called an absolute because it's a rounded complex, which again is based on radical toxin elimination and boosting natural blood circulation. So we see remarkable difference in his face within 6 weeks. And just think about it. What can it do for a younger person if it can work at 83? So let's go to something also pleasant. People want to look good and young. So we had a study done at Stony Brook University, about 10 women age of 50 plus with sedentary lifestyle. And we said, okay, we can address fat and cellulitis, but we are going to do it just on one leg and one arm. So no food or no diet or exercises can affect the results of our study. So here we are, we got one leg, 1.6 inches narrow, skinnier, let's say. And at the same time, we added ingredients which would tone the skin. So when you lose weight, the skin is not sagging. And after 2 months, the difference was so noticeable that everybody decided that, they're two different legs and they're not good. We wanted to do it 6 months, but everybody disagreed and they said that they're not going to walk on two different legs. So that was the end of the story. Same here. We have sides. And you can see we can reshape the body, technically reshape the body. You can see the line of the buttocks is visibly different. So we are ready for a beach and we are ready for nice dresses. Oops. What is happening? I guess everybody wants to see a butt, right? Okay, now let's go to something more serious, which is swelling. And swelling can occur for many different reasons. It can be heart related, it can be kidney related, it can be related to the work. And patient came in to me for facial problems, but I saw her leg swollen. And I said, how often it's swollen? Oh, every day. I said, okay. Let's put a finally cream, which reduces swelling in no time. And in 27 minutes, that was the result. And here is a video of a big athlete. He's a professional boxer. And I will let you hear what he has to say.
Hey guys, I recommend Dr. Alena cream. It's very good. I have a pain for 4 weeks. And 3 minutes, she put something in my shoulder and disappear. Look at my arm. I can move it very well. I can fight now. Thank you. My name is Angel Sierra. I recommend her.
Oops. All right. Now, the next case we are presenting is a young, fantastic boy, ice hockey player, and he got a deep cut wound, so he couldn't play ice hockey, and the game was coming up. So his grandparents asked for help because Band-Aids don't help. And again, you have to think about, if you think about natural regeneration, think about if you make dinner and cut your finger, no matter how much you're going to swear, no matter what you're going to do, you have to wait until body is gonna heal it. It's same goes for me as a surgeon. No matter how big is a surgery, what kind of implants, bone grafts, tack screws, whatever I have placed, at the end of the surgery, I have to put the stitches on and pray that body would naturally heal and accept all my changes. Surgeons is only as good as the body is. If body is not going to reject, is not going to accept our changes, we are doomed. So it is body which heals, and it has to finally come to the people, human mind, the body has ability to heal. So here on the boy's leg, you can see on the upper quadrant on July 20, we applied our cream. July 21, one day later, it's practically covered with a new developing skin. July 24th, the wound is closed. It's 4 days, and the boy was able to put skates without a pain and go to the hockey arena. Why it's, yeah. Okay, now let's talk about psoriasis. Psoriasis is a big problem. And here we're talking about a patient who had psoriasis since 2014 and have all injections and all kind of steroids and OTC creams. And can you imagine how much side effects she's getting? But the problem is still there. So we use the same approach, different cream. And you can see 2 weeks later, we still have a little bit of remnants, but hand is not itchy, hand is white, skin is white, it's healed up. Same psoriasis on legs, pain, burning, swelling. Patient is spending $600 a month for medication, and that is a result you see on the left-hand side. And again, we did the same thing. We used natural body ability to heal, and in 2 weeks later, he didn't have that problem anymore. So again, body has ability to heal. Here we're going to go to something more extreme. So somebody who is who is not that used to medical things can close their eyes, but this is a $90 billion industry for diabetic patients. Diabetic patients suffer tremendously, and they have, because of diabetes, they have a very slow metabolism, and they have tremendous swelling and skin problems. So here's a patient, 60 plus years old. He has heart conditions, lung conditions, and every possible condition. And his medication list is very scary. But this is a result. That's how I saw him, because they were looking for help. And I want to say, this is a case how I saw him. In Western medicine, if you have a swollen legs, people use, doctors use bandages. And bandage by itself blocks circulation even more. It's just so opposite of what has to be done, what I learned from Shaolin monk, what I learned in my 11 years research on natural body regeneration. So we did the same for this patient. We measured measured circumferentially his legs in 4 points. As you can see, upper, middle, lower, and on the foot. And we took a measurements, and then we applied our cream, which I'm going to call Let's Dance, because it takes swelling away. And who doesn't want to dance? And this is the same patient leg couple hours later. Do you see the difference? couple hours later. That's what body can do if you give enough toxin release and give enough oxygen. Not only we got a swelling release, but look at the skin color. We got a healthy skin color in no time. Then we kept measuring, and so this is a difference. So this is a difference in 1.5 hours. Same patient, right? Every diabetic patient can succeed just from the cream. No medications are needed. No band-aids are needed. This is a huge turn in medicine at all, just by boosting natural regeneration and boosting natural ability to heal. So here is a non-healing wound, which was, you can see the cotton swab goes in 9 millimeters, but here we used our proprietary material called ABB1, which has been proven by us at Stony Brook, but also at the third parties, that it kills all hospital infections, all lipid-coated infections, and lipid-coated viruses, including COVID. So here we are waiting until we can get FDA approval for that. But meanwhile, we can treat non-healing wounds. So this is osteomyelitis case. In observation, I could see the wound, the bone is open. So we treated it with ABB1 material. 8 days later, wound was closing up from inside without use of antibiotics. And we had only 5 millimeters. 3 weeks later, you can see there's only residual remnants of the scarring wound, which was not healing for years, was treated in 3-week time without any additional chemical medication. And this is a graft, and you can see, so this was amount of swelling, and once we put the cream, swelling went down, and without any band-aids, and patient walking, well, I mean, as much as he could walk, but he was walking around the house, he was driving to the stores without the band-aids, and his swelling never went back to the, even to the higher level, even if he was doing more walking. I also created hand sanitizer, and you would want to say, well, we have 1 million hand sanitizers, so why would you need another hand sanitizer? But the problem, I'm a doctor, and we use hand sanitizers all the time. All my staff had chopped hands, we had allergies, all kind of skin rashes. So I said, to hell with it, let's create a hand sanitizer which forms a biofilm. So this hand sanitizer, which I called unparalleled because there is not one of them on the market now, this hand sanitizer, through the biofilm from coconut esters, again 100% natural, it films biofilm. So alcohol does what it's supposed to do, kills bugs, but it doesn't penetrate into skin. And skin is very smooth, and every doctor or every person who is using hand sanitizers should use something which protects their skin, because alcohol kills everything. It kills us as well. So therefore, I created this hand sanitizer, which has a very luxurious feel, and skin is very soft, and it's not tacky at all. And there is an example, one of the examples why I created this hand sanitizer. So on a upper right corner, you can see a girl's hand where she was using hand sanitizer, and her skin was red, inflamed, and she had psychological problems to go to school because the kids were making fun of her, and using unparalleled hand sanitizer, her hands were back to healthy skin color in 5 days using hand sanitizer at her will. So now let's quickly talk about quality of the products we provide and how quality products should be processed. So let's say we have 100% natural ingredients. So how would you address, like, if you have a grapefruit and you want to have maximum amount of vitamin C, would you boil it first, or you would eat it fresh? Right? You would eat it fresh. So majority of the creams, I think only like 98% of the creams for longer shelf life and stability are heat processed. So we are getting a nice confiture, or you would call it a jam. It's nice, it's sweet, it can smell good, but it's not going to have the function because practically all active ingredients have been destroyed by heat. So this is the one thing what is really, really important, that we do cold processing of our natural ingredients, which we actually source from the best ingredient suppliers in Europe, because they have all the grandmother's recipes. Now, let's talk about how our mind is conditioned by public media. We are so concerned of what we eat. If we go to the store, we go to the health food stores or healthy food stores, and we eat, it should be extra virgin, it could be cold processed, it could be first processed. When we go to creams, what we are getting on the left-hand side, you can see there is a jojoba oil, and this one is clear to make, it's already processed because jojoba oil is dark yellow. And to make cream white, it's still, you put in a label jojoba oil, but it's already been processed, and then you heat it up. What's left is going to be in that cream from that oil? Practically nothing, just a nice name on the label. And here, it's my most kind of disgusting picture. It's you can buy aloe vera in sort of a powder which clumps up. How do you think that aloe vera has been processed? And what is left in that bag? Whereas we are using, on the right-hand side, pure aloe vera juice, which you can drink. It smells like aloe vera, it tastes like aloe vera, and it functions like aloe vera. So in food industry, we are very strict on what we eat, how we consume, what we, like, we are so health oriented. When it comes to something what we apply on our body, all of a sudden it becomes irrelevant. And I want to make emphasis on that it really should be looked after. What are you putting on your body? What are you putting on your skin? Because the skin is one of the biggest breathing and exchange organ on the body. And these are our colorful creams, because you can see that we use only natural ingredients and they are colorful. And I could say that all our ingredients are just life, right? So that would be the end of my presentation today. I really thank you very much for listening into it. If you want to look for more testimonials, please go to YouTube at AB Bioinnovations, join our Facebook group, or call us if you have any questions about your health and you want to know our opinion. Then reach us out at abbio.io. And I really thank you, everybody who spent time today. And I hope you learn a lot and know how to reset your youth and health in a very simple, safe, and fast-acting manner. Thank you so much, Alex. Thank you so much, everybody.
Dr. Butkevica, great work. Thank you.